Thank you, Brian, and thank you for hosting and chairing this inaugural webinar. I also thank Lewis Troke, Matt Dukes, Sarah Tobin, who are working feverishly to manage and monitor the webinar behind the scenes. We know our members value the program of regional conferences normally run, which we have now had to put on hold because of the current situation. We will monitor and look to reintroduce them as and when it is safe to do so. I want to thank Leukemia Care and the CLL Forum in particular for the close collaboration and the surveys and emergency COVID-19 specific webinars. This collaboration has been a trailblazer and helped enormously in the gathering of CLL specific data during this pandemic. A latest report has been sent to all survey participants, and we will be loading this report and the findings on our website shortly. I want to thank the hundreds of you who have diligently completed and indeed all three surveys. This data is invaluable to us, and we've used your feedback to influence the media and government, contribute to news items on the radio, press and TV, as well as driving the issue of guidance, resulting in letters from the coalition to help you secure shielding. We continue to work with the CLL Forum, Leukemia Care and sister charities that make up the Blood Cancer Alliance to share data, promote CLL patient needs, and to lobby government and the NHS on the needs of our community. We are involved in longer term projects and partnerships with major pharmaceuticals and associated companies to advise and influence new treatments, new pathways, new apps and resources to help our members and their families. For example, we are become part of a bid to trial a remote monitoring app to manage chronic patients and minimize their need to visit surgeries and hospitals. We've run our first webinar for the under 60s. Well done, Gail and Nora, which was rated highly by those attending. And we're now starting to develop a suite of Live Well with CLL set of resources you will be able to explore and use via the website to help you keep mentally and emotionally positive at this time. Your feedback from the survey will help structure the resources we post. You will also have noticed the member bulletins and news updates have greatly increased, along with the use of social media channels to keep you up to date with latest guidance. And we are adapting to face new challenges such as the NHS Scotland, England, Wales and Northern Ireland. And one of our recent joinees, John Greensmith, will be focusing on the Scottish members, running a Scottish member conference and streaming info so we can give specific Scottish information on the website and bulletins. As I understand, 18th of June is the earliest for Scottish members to start shielding easing. Now, if you can spare some time, live in Wales or Northern Ireland and want to emulate John, drop me an email and a phone number and we can have a chat and see how we can best help you together. I thank the volunteer team of trustees and those champions who have CLL or have a loved one with the disease, and they've risen to the challenge magnificently to support us, our community. If you are interested in joining the Happy Gang and have some time to spare to help out the community, feel free again to email me and I will set up an informal chat to explore how you may help us and your fellow members. If you have some knowledge of technology, financial skills or medical background, we would love to hear from you. If, like me, you're a willing pair of hands, then also please do contact me and we can explore how you can help. You can also help with funding the work. We rely a lot on member donations and fundraising, and as you understand, during these times, this is dried up largely. Some of you have already started to donate via the new website, and some have set up regular donations. Even a £5 a month would help continue the work of the charity. Finally, and most importantly, I know from calls, emails, and the online forum, many of you have suffered stress and loss. I want to recognize the pain members have suffered. Some of you have told us of the stress of having treatment delayed, being furloughed from work, or getting and thankfully surviving the virus, through to most sadly losing a loved one. Our thoughts and prayers go out to all touched by this disease. We will continue to do our best to support you, your partners, to the best of our ability. Thank you.